hearing about in the last 1 week. Yeah.
I mean, Bernard, you have been studying this like, I mean, a university course.
Well,
what have you learned so far?
You know, new data is showing us that at least 25% of those infected with COVID-19 will not show any symptoms. So in the past, only health professionals were wearing masks, so that if somebody came into their hospital and they knew that the person was infected or they suspected, they would preserve themselves. But now that at least 1 out of every 4 people infected will not show any symptom, that means that if there are 4 of us here, 1 of us could have it and I wouldn't know. Okay, so that's point number 1. Point number 2 is that there are studies, and Hong Kong did a study to show that a family of 7 went to Wuhan in the previous month where COVID-19 was very high. They are suspecting that now, apart from large droplets, COVID-19 could be just in the atmosphere. And in fact, some of the studies say that if somebody who had an infection without symptoms maybe sneezed, the droplets could remain in the air for at least 20 seconds, and the droplets can move as far as 2 meters. That's almost like between where I'm sitting and where Samens is. So the US and Singapore, 2 of the key countries which were saying people shouldn't wear masks, have now varied their advice. And they asked President Trump, what if people can't get normal N95s like Samens on? And they said, even if you have a cloth, wear it. It's better than nothing. And we are saying to people that whatever you can get, we have a lot of people who are sewing homemade masks. Get one. If you don't have the money to buy a mask, you can design one. You can even tie your face with a clean handkerchief. It's better than nothing. Because if you look at the case count globally and the way the Western world is reeling, and you look at how relatively underprepared our health facilities are, the fewer people who get infected for us, the better. Which is why Citi FM, Citi TV is saying, wear your mask as often as you can.
We are wearing our masks, you know, we are doing everything, fumigation. In fact, we have even done prayer and fasting. But we keep recording new cases. I mean, as of this morning, our case count stands at 214. We've recorded 9 more. Are we winning this fight at all?
Well, I think that you always need to look at this from the point of view of what if the things we have put in place have not been there at all. Okay, so it could have been much worse now. That doesn't mean that the 214 is the real picture, but it gives us a snapshot of what to expect. So the way the virus works, and I'll explain. So if one person has a community transmission and the person is not an imported case and the person is not quarantined or isolated, in a week he would infect 6 other people, because the virus multiplies. On average, you infect 3 people every 3 days. So if the person got infected on last Sunday, by this Sunday, 6 other people would have had it. So end of week 1, there will be 7. Using that progression, end of week 2, there will be about 80 people infected. End of week 3, there will be about 2,300. And then it moves into the 28,000. So my point is that the virus and the infection rate grows very fast. Now, you ask whether we are winning the battle or not. I can't tell. What I can say is that if we hadn't quarantined 1,030 people, we wouldn't have known that 80 of them were carrying coronavirus. That's point number 1. Number 2, if we hadn't insisted that those 1,030 people, including those who tested negative, if we hadn't insisted on keeping them in isolation for the length that we did, based on the information we got today that 1 of the 9 is somebody who initially tested negative. We may have released somebody out there who may not have known that he was positive, right? So my point is, some of the things we've done are very good, and we need to make sure we continue. There are other things that where we are means we should do, which we can come to. But hindsight is always very perfect. And I'm saying, if you look at what has happened in the past 1 week, we have to be grateful that we closed the borders on time. We have to be grateful that we quarantined some people, and we have to be grateful that we are racking up testing. If we hadn't done those things, who knows where we would be by now? So those are my preliminary comments.
Right, so Samens, there's one person who earlier tested negative, and now the second test came out positive. We've also asked some people to go home, to go and manage themselves. How safe or how prudent is this decision?
Well, again, when you're asked to go home, you are given a set of protocols to follow.
Yeah.
If I may just...
Please feel free.
You made a point, so you can
Yes, exactly.
You are given a set of protocols to follow when you're asked to go home.
Mm-hmm.
So when you're asked to go home, it's not to quickly just jump and be everywhere, So it doesn't pose that kind of danger. But the first point that you made about somebody who initially tested negative
and later positive.
They were tested when they were admitted to the place. Okay. Now, when you are admitted, mind you, they were kept in a bus for hours before they disembarked to go into their hotel rooms.
Yeah.
So it may well be that just close contact with people who were already infected could have triggered that as well, which is a possibility.
Yeah.
So anything at all can happen with a situation like that. You asked Bernard the first question, whether we are winning. And again, I like for us as a nation to move away from this winning or losing issue. It's whether we are making progress. That we have been cultured to look up to themselves are struggling with it. So are we making progress? And I'll say significant progress. Can we do better? I'll say yes, we can do better. Could we have done it any other way? I don't know, because resource constraints would instruct government or the policy maker on how and when to move. So far, I would say that we've made progress, because there are other countries that have not been able to figure out even how to achieve this recovery rate that we have achieved. So yes, but we can do more. And as Bernard said, hindsight will always give you a perfect picture. But
yeah, and from to couple what you're saying, see what is complicated is, so a week and a half ago, everybody was saying that Singapore is doing very well. Right now, they've seen their highest daily jump in cases today. So the government is quarantining a large number of foreign workers. Right? Spain, which was doing very badly, has seen a major decline in deaths. They have 674 today, which is lower by 130 from yesterday. So suggestions are that Spain may be coming down in terms of their curve. And then there's possibility that Singapore may be relapsing. So the point is, Samens makes an interesting point that there are no benchmarks and everybody has a different battle. So I interviewed my microbiologist from China, and I asked him how Wuhan treated COVID-19. He says, look, for them, whether your case was mild or severe, you were in a hospital, because they could build 13 hospitals in a week. And even with those with the mild cases, after they felt they were better, they kept them for another week and did another test before they send them home.
Just to make sure
that's their strategy based on their local conditions. We have decided that, well, if somebody recovers, even though the person has to be treated at home, we'll give them some protocols. So if we had more resources, we would have kept everybody in the hospital.
Exactly.
So it's just to say that it's very difficult to, even though there's no global standard, you just make sure you are optimizing what you have, okay? How are we optimizing? Are we informing people as much as we should? Are we enforcing the lockdown the way we should? Are we testing as many people as we should at the right places? So for me, if we look at our condition and the decisions taken, then we can be in a better position. So it's more like we are analyzing our actions based on our limitations and our resources. Although there are global benchmarks for different things. So I hope you're not. So there are certain things you need to do. For example, once you have local cases, local transmission, testing has to happen. So that one, whether you are in Kuwait or you are in Kosovo, once you are seeing local transmission, indeed, when you quarantine and you lock down and you don't test, you are defeating the purpose of the quarantine. So there are some things globally we can say that where we've gotten to, as the scientists say, test, test, test. So that I can say to you, how well are we doing? The jury is still out there.
Right, so Samens, when you look at the cases we've recorded today, we have about 3 or 4 of them who have no travel history. They've not come into contact with any confirmed case. but they have tested positive. Now, an example is the Upper East case of a woman who traveled to Takwa and stayed there for a week, came back to Bolgatanga, and this. Should we begin to worry about possible community transfers?
Well, there are community transfers, and that's why there's a lockdown.
Yeah,
That's why there's a lockdown.
the magnitude of it.
Well, we can grow the community transfers if we keep defying the lockdown. If we keep defying the lockdown and people misconducting themselves the way they are. This morning, while I was on radio, people kept sending messages about young men playing football in communities, and they won't stop, you know. And I have a more ruthless approach to some of these things. That when we called the military to join the police, what were we thinking? That the military, are they Red Cross? Military is military. Yeah. The moment you call military, it means that there is a certain level of enforcement that should be scaled up. So when people openly defy the police and we tie the hands of the military and tell them to run, what outcomes are we expecting?
You're fighting human rights.
No.
No, I'm saying that. No, I'm just saying that. Then don't call them.
No, you can call them. You see, don't forget when we interviewed the police, they said that this was a non-combat operation. So it means that within the remit of things they can do, the military know how to conduct themselves in a civilian non-combat way, as they can conduct themselves also in a highly...
So what happens
I'm
to the
not
police
talking
then?
about combat. I'm just saying that
I know you agree.
we know that our military,
yes,
they have been trained in a certain way. Even when you enter a military barracks, the way they comport themselves, the levels of discipline.
Yes.
Now, I am saying that the moment we as a country determine that we need the military to help with enforcement, then we should expect that it's something that is scaled up beyond what we expect the police to do.
Let me make a point there. It could be two things. So
let me ask this question. The flouting these directives.
Yeah.
Should we be looking at human rights in this not so ordinary times?
We have to look at human rights everywhere. You see, there's always a tension between national security and people's individual rights. But the police have been clear. Shilabeye Bachman has told us that if you flout the regulation, you will be arrested and you'll be sentenced. So it's not as if there's no punishment.
Yeah.
The point is that people, because of their oblivion to the seriousness of the virus, are subjecting all of us to risk. So the question is, how should the police and the military treat errant members of the community who are breaking the law and endangering the larger sections of society?
Yeah.
Combat operation, humanitarian operation they are doing. They are not fighting a physical enemy with guns. That's number one. Number two, they know that corona, being the enemy, is spread through human contact. Yeah. So they have to limit the human contact. Now, the question then becomes, what is the most reasonable way of enforcing the law? Is it through beating people physically or arresting them and letting what the law has prescribed go through? I know that in certain instances, it's very difficult to do this latter, but that's what the constitutional order we have chosen, that's what it prescribes. So if somebody is breaking the law, you arrest the person and you take them through the process. Immediately you circumvent that, you begin to pick and choose which is legal and what is not legal. The other point about the military's involvement. So you're saying we brought the military in and we know the way they are trained. That's true. But one of the reasons we brought the military in is also that if you look at the number of police we have in the country, we did a bit of work in 2016 elections. In fact, based on our calculations as of 2016, we have more polling stations than police people. Yes, because we have 26,000 polling stations. At the time, the police went up to 25,000. I'm sure the numbers have increased. Now, if you are enforcing something of this magnitude and you deploy all the police in the country, it will still not be enough. So my argument is that we brought the military in not because we wanted them to come and beat people. We wanted them to beef up because there's military, there's immigration, it's a joint operation. Having said all of this, I think our job is to let citizens know that in flouting the law, you are not only expressing your right, you are endangering the whole country. So you can be treated as a hostile, errant person because your recklessness is going to cost all of us. Okay? But that punishment must be meted out within the framework of the law. Because we know where we've come from the military, and we shouldn't justify or be seen to be attempting to
Bernard, what I'm saying is that it could be military, it could be police, it could be fire service, it could be customs or immigration. But when we were calling them military,
what did we have in mind?
What did we have in mind? I'm just saying that
to come and implement the law.
Well,
to come and help,
I'm not
to come,
so
to come
sure
and be
whether
part of the team that maintains order and enforces the lockdown.
No, I agree.
But Sames,
I agree. Theoretically, I agree. But I'm just saying that why are we surprised that the military is beating people?
We should be.
Because
because we've been in a democracy.
Yes. No, we shouldn't be
since
surprised.
92. We should. You see,
no, we shouldn't be surprised. We should be disappointed, but not be surprised.
Once we say we are not surprised, it means that subtly we are saying this is what we expect you to do. We don't expect them to do this because where we've come from and based on all that we have seen. 30 years ago, I couldn't have been on radio speaking. The country has moved on. And I'm sure the way the military is trained is also aware of the dispensation we are in. So if anybody goes on the street and thinks that randomly beating people is normal, that can't be correct.
Why do you say random? Why do you even use the word random to justify what you are saying? It's not random. What I'm saying is that I'm not surprised. As for me, I won't be surprised.
Because of how we know the military to behave.
Yes.
Now, so if we've given discretion to the security services, and if they are supposed to determine to a certain level who is going out there to get medicine, who is not going out there, what happens? Because if there's no clear-cut measure as to what to do.
What I'm saying is that the danger to people's rights, that's the disobedience, if I should say, of citizens can cause to us is more than what a military man could do randomly, as Bernard puts it, to somebody who decides that, look, I'll flout the laws and whatever happens should happen. Because in so doing, you are the potential of infecting more people, which is a national security issue.
Okay, so
they should apply the laws, yes, and they will have to apply the laws. But I'm just saying that customs could be added to it. I don't know whether customs people have been added to it to ensure that, as we do during elections. If we want to see proper adherence to the lockdown laws, then we should wake up, because what we are seeing in the suburbs, in the communities, I will be very surprised if this thing is not extended.
Right, so you are still watching our live coverage on COVID-19. You can also be part of our discussion by sending your comments to our WhatsApp number 0550-585832. Don't call, just send us your message and we will address that for you. Now, Bernard, we are on day 7 of our lockdown. What's your own assessment of where we are so far?
Okay, so because the lockdown tries to balance the objective of keeping people at home with allowing those who run, there's always going to be a tension between everybody staying home and people who have to moving, which has resulted in what we've seen, for example, with health workers, where because we don't want trotros to move into certain zones, they are having to face problems in getting to work. It's very early to assess the overall lockdown, but I'll give you two points, two things I'll say. The extension of the border closure is a hint that 2 weeks of lockdown will not be enough. Number 2, I said this yesterday, the 48-hour window between the time the president announced the lockdown and when it was enforced created a flurry of activities that increased interaction. That suggests that if there were people who were infected, they could have infected more people within that window. And that means that you need to give yourself more than 2 weeks to assess the overall situation after that 48-hour window, to be sure of your situation before you reverse the lockdown. So I'm saying that based on these two premises, as I mentioned, I'll be very surprised if the lockdown is not extended, because it would not have achieved its overall objective based on us flattening the curve, limiting interactions, and knowing the real number of people infected. 2 weeks is too optimistic to want to keep this lockdown. So I don't think I think it will be extended.
What about 1 week of lockdown? Your assessment?
1 week, I mean, look, Because you are changing the way people do things, the way people behave, and it's something that even when we were told that don't touch your face, I don't know how many people have been able to achieve that.
Yeah.
So you grow up, learning to do things in a particular way. People wake up, they are taxi drivers, the next thing they watch their taxis, they are on their routes. People go to the market, people go to work. So the moment you disorganize this, it takes a while for people to come to terms with it. I would say that we are making progress. I would say that we are making progress. Yesterday we had a meeting somewhere late in the evening, and when I drove back into this part of town, I mean, I could feel the haze of silence hanging in the air.
So thick you can touch it.
I'm telling you that, and it got to a point I was afraid, like, where is everybody?
Yeah.
Nobody, and I'm talking about 9 p.m. in Accra. Nobody. So we can say that to a large extent, but where we haven't done well is managing our necessities. Because you also notice that the places where we have had spikes of interaction will be where people necessarily would have to go, like the marketplaces. Check the routes to the markets. That's where we've had the most dangerous interactions. Apart from the markets where people will have to buy food. I mean, I tried checking out a few hospitals and clinics yesterday because I said, well, people will still go to the hospitals. In fact, one hospital that I saw, it had been closed. It had been closed down, I mean, a private clinic. And so people still, and then people are not able to sustain themselves by buying food that will last them 1 week, 2 weeks. The middle class can do it, but people that live on daily wages and, and so that's a genuine challenge.
Let me just do a final point. When you ask whether we've done well with the lockdown, so Google released their mobility report. So Google, they're able to predict movement based on maybe mobile phone data and traffic. And if you compare the results of Ghana to South Africa and Rwanda, mobility in Ghana is much higher than South Africa and Rwanda. So if there was going to be any global assessment of a lockdown in terms of how mobile are people, in terms of whether they are moving around or not, we are still moving more than Rwanda and South Africa, who are using more draconian means to implement their lockdown. So even though people are complaining here, our approach has been very, very muted, because in South Africa, in Rwanda and other parts of the continent, it's been more brutally enforced. So I'm saying we should get that relative in mind. So even though we are simple at playing football and things, and the police could have done more to keep people in, I'm saying that our lockdown hasn't been as seriously enforced as other countries.
But shouldn't we be
looking?
Shouldn't we be looking at that? Because, like Samuel rightly said, the market. Now, the way people are moving, if you sit back and watch, is very scary. Now, this has even made the local government minister made suggestions that we may possibly have to shut down the market if this is how we are going to be going. Should we begin to take drastic measures like that?
I think that two quick things. You see, South Africa is the way they shop. So I interviewed a doctor in South Africa last week, and she was telling me that most urban South Africans shop from the main shops, but when you go to the townships, it's different. So the townships, there's more movement than the main shops. Now, we understand the way we work. The Monday we did the initial disinfection, there was no movement in town. I think that the local government ministry may have the key to this lockdown in terms of which markets they decide to open and how they open the market. Because a lot of our traffic in urban Accra is market induced. Now, if people are anxious to go and buy on Friday, they will just go without any order. So maybe the local government ministry can be a bit nuanced and say, you know what, let's open Malata on Tuesday, but only half of the shops will open, and only those who sell this kind of good will come out. It may take a bit more planning, but I feel that the key to movement is markets. So you can use that instead of simply saying we are going to close down all the markets that are not obeying. You can use some sort of incentive to make sure that some markets remain open on some days and only a certain kind of people can move. In a sense, I don't know, it's easier said than done. But I just think that the local government ministry may hold the key to helping this lockdown succeed. Sometimes,
how do we make things right? Because if we are going to extend a lockdown and we are still doing things the same way, then what's the point?
Well, what's the point? That's a legitimate question. Well, I think that there's going to be the need to scale up the lockdown. And straight away the markets will come to mind. Even some of the commercial drivers, the way they are operating, you go to the lorry stations, suddenly they are populating themselves again, you know. The only thing is that the government again will have to increase their interventions on providing food for the less fortunate. I'm aware of some interventions that they are doing with the churches, providing rice, providing eggs, providing, you know, to some communities which I know the churches are going to roll out. So if they are going to scale that up, then we might have to bite the bullet and do a more quote and unquote radical lockdown. Because we are now seeing the results of the community infections, it's very important that we take it seriously. Because while the first phase of our infections have been controlled because most of them were under quarantine, when it comes to community infection, there's not a lot you can do. You made mention of a lady who traveled from Bolga to Takwa and back to Bolga only to be tested to find out. I would say that, how do we manage transits? Which route did she use? Who did she sit next to in the vehicle? You know, all these things. Now, because we cannot control that, that's more the reason why we should take the lockdown a lot more seriously and enforce. Because if we don't enforce the lockdown to a higher scale, then we are going to have a hard task.
You know, talking about how we are going to be managing transit and all, there are those who have also, I mean, those who are in compulsory quarantine who have tested negative. They've been given the clearance to go home, but they were told that authorities will be there to guide them as to how they are supposed to be doing that. Now, some of them are worried because they have not heard anything. And in fact, Caleb Kuda visited MG Grand Hotel to interact with some of these people because they appear to be quite frustrated. So let's take a look at what their grievances are.
And today I asked the same question and they said, oh, they were making arrangements to get us a bus. Then I didn't hear from them again, so I had to go back and find out what was going on. And then when I went, I was told that we should wait because they don't know if we'll be able to go today or not, and they don't even know because they would have to collate all the other hotels. I asked how many hotels, they said they didn't know them. The number of hotels left, and so I was like, so what happens to us? And they're like, well, you just have to wait, and then we hear from our bosses, then we get back to you. So right now we are here. I don't know if we are going home today. I don't know if we are going home tomorrow. Nobody's telling us anything.
So how does that make you feel?
It's quite annoying and frustrating because I was expecting that at the end of the 14 weeks, because they kept asking us, where's your address? Yeah, 14 days. Your address, where are you coming from, where are you going to? They kept asking throughout the process. So I was expecting that at the end of the process they should have made provisions for all that, but you don't wait till the end of the process and then you tell me that we don't know how you're going to go. And then they gave us a code which apparently we are supposed to use, but you know, because of the lockdown, which driver would agree to travel from here to the north? So
where are you headed?
I'm going to Tamale.
You're going to Tamale? You and your mom?
My mom is supposed to go back to the States. On the 2nd of April. They took our second samples and then the results came in yesterday.
So all test results proved what?
Negative.
Okay.
Negative.
When you finally found out the second one proved negative, how's the feeling like?
I was happy, like I was like, finally I can go back home. So the excitement and Charlie.
Who is here from Oh, okay. So how has the family been feeling like back at home?
Well, it's quite frustrating because not everybody really understands how this whole thing was working. So you'd have people ask you, did you test positive? Are you negative? Like, what are they saying? When are they allowing you come home? So yeah, I think they were anxious.
Right.
But constant communication made them relax a bit.
So who is in there now? How many more people? Do you have an idea?
Personally, I don't know the number, but I know one who is from Upper West. I don't know, and I think according to him, we are about 3 people from the north. I don't know those coming from Kumasi, how many they are, because some have already gone home. So.
Okay. So what's happening here and how's the process like?
Well, at the moment, we don't know our fate.
Tell me your full name.
I'm Mabel Asante Bekwe.
Great. How long have you been here?
Oh, for I think 15 days. Today is the 15th day.
Okay.
Yes.
So where were you coming from?
From Nigeria.
Okay. How has the experience been like?
Oh, it's been quite good because we need to save a lot of people from this disease. So the way they quarantined us, I think it's a good experience. At least we are protected. We are safe from all this. The advice that they were giving and all that. In fact, it's quite a good experience.
You've had 2 tests.
Yes.
What were the results?
Oh, they were all negative.
How did it feel like?
Oh, I felt good when they came out with that results. So the advice they gave us is going a long way to help us.
You are reconnecting with your family today.
Yes.
How does it feel like?
I feel so good because it has been, boring staying within, a confined area for so long a time. It's a good, a big relief to some of us.
So those are some of the people who were under compulsory quarantine. Now they have completed the 14-day exercise and they've tested negative to test. And so is going to be a challenge.
No, when I read the information minister's tweet, I thought the arrangement had been made that they will be supported to go. Don't forget, Caleb spoke to them this afternoon.
Yeah.
So if they are still there by now, I'll be surprised. Okay, because the hotels were quite mini. What struck me though was, people are walking around the street disobeying the lockdown. Somebody has just had 15 days of their life taken to save your life. And they went through, some of them were not happy, but 15 days of sitting in the same room. Maybe the police should arrest 1 or 2 lockdown breakers and process them for court so that they will see that freedom is useful, it shouldn't be abused. Again, because 15 days sitting in the same room can drive you nuts. Okay? And here you are walking through, you are playing football in the park. It's not right. Okay? So I think that this is a small issue. I don't think, if you listen to most of them, they are happy with general treatment. It's just the issue of going home, which has become a problem because of the lockdown. I don't expect that problem to persist after tomorrow.
Sometimes watching the people talk, I was just smiling to myself that, okay, so they've gone through the both tests, they've gone through the quarantine, and they are safe now. If you look at stigmatization out there, I think they have a genuine reason to be smiling now. How should we be dealing? Now, you hear somebody cough and you just want to vanish.
Please don't cough.
Oh, man.
The stigmatization is what is killing people out there. So people are not.
They said in the report yesterday, Fred Awuni said the lady from Takwa, when she got back to the hospital, there was catheter. And then he spoke to some of the people around who were expressing a lot of concern. I think we need to continue educating people that in a hospital, for God's sake, that's not the place they should be scattering.
It's not the kind of thing that you need to be treating people like that, in my mind, I always say that I will consider anybody that has it like having malaria, because we have, from what we've seen that it's treatable. That because people have been infected or they contracted a disease, and they have been they've gone through the whole process, and they've been restored back to their good health. So there's nothing embarrassing about it. That if I had it today, I walk to the hospital, I am isolated, I go through the system, and then my health is restored. You know, there's nothing that should make anybody feel embarrassed. I mean, look at the lady, spoke so beautifully. She's been quarantined.
Yeah.
She's gone through it. And listen to what she said. It says that I'm happy with what I've been through because it will keep others from getting infected. This is somebody speaking sense after all the experience that she's gone through. So I think that it will be unfortunate, especially workplaces, even churches, even families, when somebody has gone through the whole process and comes home, you know, and people start dodging the person, calling them names, and you know, it's so backward. We can't do that.
Right, so I'm going to be taking some of your messages, and when I'm through with that, we are going to be talking about the relief that Citi TV is bringing to health workers. So from Dikadi in Spentex, it says, what protective gears were or have been given to the hoteliers or staff of the quarantine centers? Now, he also says the Atomic Energy Commission researchers are saying that radiation equipment can kill the virus of all PPEs. What is the government doing about that science and technology agency of that ministry? Elom from Bachona says the transportation organized by Omni Media is solely for nurses or clinicians. What of the staff of the health facility? So we'll be addressing that as well. Awudiye Bernard from Medina says, I'm highly elated to hear that Citi TV has contributed its quota towards combating the novel COVID-19 pandemic. May the good Lord bless Citi TV and Citi FM for the support. Kudos to you and the team, and Frejabano as well, right? So that's my producer. Now, Catherine in Tema says, I'm very worried about all the ignoring unintentionally given to all other deadly diseases like meningitis and others. Before COVID-19, we couldn't control this meningitis, even in the upper regions, pleading the health authorities pay attention to our system, not only the current situation. Now, the people on the street are not there just for sightseeing. Most of them are on the street because they want to make ends meet. People cannot obey the lockdown when they are hungry. This is from James in Lomnava. And Dan in Banana Inn says, good afternoon. Most people who flout the lockdown will not be prosecuted because most of them cannot pay the least fine, and our prisons cannot take more. So the beatings will still continue. Bernard, so that is somebody just telling you as it is. Now, I mean, for the comments that have come in, is there any that, sometimes you are going to the buses that we are putting out?
Before you do the bus, I can say something quickly. You see, based on all we've said, it looks like the lockdown may be extended. But that also means that economic activity is going to stall for a month. And I have interviewed the finance minister who gave details of the fiscal impact of COVID-19 and also spoke about the CAP, COVID-19 alleviation program, and what government wants to do. But he didn't give details, and he says that the details of the CAP will be fashioned out shortly. I just want to appeal to the finance minister that they shouldn't just look at industries like tourism, hotels, and health. The economic impact of COVID-19 will hit every industry. In the UK, as I'm speaking to you, in many industries, the government is paying 80% of the salaries of workers, and companies are paying 20%. In fact, the Liverpool team I support, Liverpool Football Club, they are being bashed because they made so much profit that they have chosen to opt for that. And people are not happy. But the point is that in certain countries, government is actually paying salaries for companies. Now, I think we shouldn't look at COVID-19 just as a health or economic problem. It's a humanitarian crisis. In Ghana, the average wage earner looks after at least 4 people. Now, a lot of companies are going to lay people off, and some have done that already. I am praying that the government comes up with a very reasonable incentive package to encourage people to let companies keep their workers in employment. You understand? Because I think the unemployment crisis that COVID-19 will create because people can't get business to run, it's going to be very, very serious and going to be socially devastating. And so it's surprising for me when I hear the GRA advertise in the newspapers and keep saying our offices are open, are closed, but
have
please,
a short code.
You can pay with short code. I think that shouldn't be what we should be talking about at all. I think that if you look at the reality of many businesses, stretch your eye behind you, most companies will not open for another 2 weeks. So if the government doesn't find a way of incentivizing companies of all sectors to keep people in employment, and we only look at the macro issues, and we are thinking about tax, we are going to create a social unrest. So I am saying that the details that the finance minister wants to, and I can say this on Thursday because I interviewed the guy, I have the document here. He's saying they are fashioning out the details shortly. And I'm really hoping that he sees keeping people in a job as companies contributing to the fight.
Yeah.
And so all these PAYE, VAT, and all these things, they harass people, close down companies for. There should be a moratorium on that. As we are talking to you, there are issues around LPG and fuel prices and electricity and tariffs that people are complaining about. So I am urging the government to think of the job loss effect of COVID-19 and come up with a very well-targeted incentive package to encourage companies to keep people employed. Otherwise, the unemployment situation will be disastrous.
Papa, let me get your thought on this as well. I mean, from a businessman's perspective, what will an extension of a lockdown mean?
Well, it has economic implications, as Bernard has said, and taking a cue from other countries, and some people are paying supplementing salaries for companies. Some people are giving breaks on taxes. Some people, different schemes, of course, depending on the level of your resources. And so anything that goes beyond what we have now would only go to aggravate the economic down side of it. But hey, it's for the government to decide on what they can handle or what they can manage. And I think that if there was any time for us to bite the bullets, this will be the time, and we can't go beyond. It comes with, people are going to lose their jobs. Some companies are going to collapse and never wake up again. Some people are going to lose their spaces in the businesses. A lot of things are going to change. But what we will say is that the government cannot sit unconcerned about people losing their jobs. And by this, I'm not talking about public service workers. I'm talking about even in the informal sector. Even in the informal sector, those who are importing things, those who are exporting, those who are, craftsmen, service providers, hotels, restaurants, across board. There needs to be a certain level of intervention, which means that the government should be prepared to lose some revenue.
Right, so everybody is going to be affected if there is. People have already felt it. Some are home, some businesses are also shutting down. But to the health workers, there is going to be some relief beginning tomorrow. Samens, what did the health workers do to deserve this?
Well, it's a legitimate question if you look at it as extending an offering to the health workers for their own benefit. Hospital only to be told that the doctor is late because they don't have access to transportation. And so, yes, it's just to add our bit to help them get to work and back home so that they can be of service to us. Having said that, it's not a total solution to the entire problem. We are just one company offering what we can. Indeed, we have 4 buses plying 4 routes. So there are other routes that other people can take on. In fact, word came to me when we were coming into the studio that the Transport Ministry is making a certain arrangement to add to what we are doing or something like that. I don't have the full details. But what we have done and what we have planned, and we have branded our buses and everything this morning. The buses, our Lolo buses are ready. The routes have been up. I'll go through the routes again after Bernard speaks, and then so that nurses who find themselves on these routes can take advantage.
Bernard.
Well, for me, I think we've said it already that, you see, we are not in ordinary times. And because of the work we did last week in covering the lockdown, we noticed the bottleneck. It gave us insight into the unintended consequence of a good policy. which we decided that with our meager resources we will try and address. That doesn't prevent anybody from doing other things to support.
Yeah.
PPEs are important. There's a lot of people who are saying that they are hearing announcements of PPEs, but they are not seeing the PPE in the hospital. These days, I can see nurses and doctors are sending me more messages than any other person. When they hear of a donation of PPE, they'll say, where are the PPEs? We are not seeing them. So my point is that we all need to do a lot much quicker. So this is just our own way of saying that there's a lot more that we can do. And if you are watching, you're listening, and there's something you can contribute, find a way of being part of it. Even though we are in difficult times, this is the time to also show your humanity.
Absolutely.
So don't just sit home and say, well, I'm thinking about myself. If you can contribute something to any of the initiatives, please go ahead and do it. It will help to move the health workers, because I think they are the real heroes here.
Yeah.
Because as I'm talking to you, before we came on air, Citi Newsroom just put up a story, if you can permit me to read it. And it says that a doctor and a nurse test positive at Kolebu for COVID-19.
Yeah.
Obviously in the line of duty, you see. So these people are doing so much, risking their lives for the rest of us. And
Bernard, even for us as journalists,
of course,
for us as media men,
of course,
we are out there reporting, following politicians, going to marketplaces. You know, we are also exposed.
Yeah.
So don't be surprised if you wake up tomorrow to hear that media people, journalists as infected.
Or even CNN, their main host, the brother of the New York governor, Chris Cuomo. And he's reporting from his house.
You know, so putting the information out there on social media, I have received a lot of messages for health workers who are in Accra being very happy, and a lot of messages from people in Kumasi, people in Tema also saying, we are also here, we also need to go. The lockdown is also effective here. So in order not to have people dress up in Kumasi and go and stand by the roadside waiting for the city bus, please take us through the routes. Where are we going to be? Exactly.
This is for not Greater Kumasi, but Greater Accra without Tema. Okay, so route A is Amasaman to Kolebu.
Okay.
So Amasaman, we take off at 6:30 a.m. Through Fise, Pokwasi, ACP Junction, Ofanko, picks up people at St. John's.
Okay, so we have the information on the screen.
Mile 7, New Plan, Achimota, and then it detours into Achimota Hospital, comes back to the Achimota Old Station, Abeka Junction, straight to Nkrumah Circle. Now from Nkrumah Circle, go straight to Princess Mary Louis Hospital, Asha Clinic, and then Kolebu. That's where it ends, Kolebu.
Okay.
Route B is a Kaswa to 37 Military Hospital one. Okay. So it takes off at Kaswa 6:30. First stop, Amanfro Polyclinic, and then it comes through the toll booth, West Hills Mall, Wager Junction, and then we go through Bawe Hospital for drop-offs, Malam Junction, Sakaman, Odoko, Dakuman Junction, Dansuman Junction, right through Kanishi Polyclinic, and then from Kanishi Polyclinic we go through Kolebu Teaching Hospital, and then Princess Mary Louis, and then it will pass through Rich Hospital, and then off to 37 Military Hospital.
Okay.
Route C, Sakumono to Kolebu. Sakumono take off 6:30, Estate Junction, Junction Mall, Raviko, right through next door, and then it will go through Lekma Hospital for drop-off, come back through the Bush Road, Labadi Beach last stop, all the way through Laboni Junction to Police Hospital, pass through Akwaje to the Rich Hospital, that's Greater Accra Regional Hospital. Again, from there, it will go through Princess Mary Louis, Kolebu, and then this one ends at Mamprobi Polyclinic. And then the last one, Route D, Ayi Mensa to Kolebu. So Ayi Mensa from Eburi. So it takes off, we drop off first Pantine Hospital. Then we come back through Adenta Barrier, Medina Zongo, all the way to University of Ghana Medical Center. That's Legon Hospital. And then Oponglo Shiashi, all the way to 37 Military Hospital. From 37 Military Hospital, we move straight again through Rich Hospital to Princess Mary Louis, and then we end up at Kolebu. So these are 6:30 a.m. 6:30 a.m. Now, what will happen is that if you do look at the arrangement on the board.
Yeah.
We depart from the residences at 6:30 a.m. and then
we get to the end at 9 a.m.
We get to the end at 9 a.m. and then from 9 a.m.
we start from the other end.
Actually, it's a 2-hour journey as well. So 9 a.m. we leave
the other
hospitals back to the residences. And then 11:30 a.m. we do the afternoon shift. So we start running the afternoon shift, and then by 1:30 we should be done. And then 2 p.m. we move back into the system, back into the residences. And then in the evening, again, it starts at 6:30 p.m. Pick them, and then we do the last run back to the residences at 8:30 p.m.
Right, so now we have detailed information out there. So if you are watching, this is the route for now. I don't know about later. Maybe Citi TV might be gracious, you know, to extend it to Tema. But for now, beginning tomorrow,
well, we will. You see, depending on, as I said, I had a few calls about some government trying to do something. I don't know the extent, but based on what we are receiving, we may see an addition of Tema and Ashaman very soon if the government intervention doesn't cover Ashaman and Tema.
Right, and so that's some good news coming in there. So this is it. Quickly, I'll just take your closing remarks. Bernard, just 30 seconds.
We are in this together, and the most important thing is to believe and be responsible.
Okay, Papa.
Well, you've stayed home for 1 week and you are still looking good. Just buy a skipping rope and start skipping, because the weight, people are eating everything. They open the fridge and then they start smiling. Then they say that we are not Anyway, look, just let's stay home and do everything as we've been directed to do. This too will pass. As we say, this too shall pass.
Absolutely right. So Bernard and Samens, thank you very much, and thank you also for being our guest. But just know that nation building is a collective responsibility. Fighting COVID-19 equally is our collective responsibility. And so Citi TV has decided to provide buses, free bus ride for our health workers. Others are also giving PPEs. Others are in fact giving food to people on the street. So whatever you can also do, there's so much that needs to be done. I mean, just
you asked the question earlier, whether it's limited to only nurses.
Yeah.
Not only nurses, health workers. So long as you have your ID card. So long as you have your ID card.
Okay, so the lady who was asking me, can a bank worker join? I beg you, the answer is no. But now, maybe somebody, another company is watching and they may want to look at the nurses. I mean, the work is so much, you know. We need a lot of
year, they declare so much profit and we clap for them.
So this is the time to show your powers. The time to show your powers. Let's all contribute in fighting COVID-19. Thank you very much for watching. My name is Premier Dunyami. We have other interesting programs lined up for you, so don't go away.